Good day, sir. I'm Aramiping Paklanak, student nurse of Holy Trinity University. So now I'm going to assess the therapeutic BAT for my patient. If it spans BAT, TSB, kung definition is a process for providing calling measures to patients with elevated temperature using tap water. This is a purposes of to reduce fever by dilating superficial blood vessels, thus releasing heat and lowering body temperature. Then, to lower symptomic temperature when a routine fever treatment pills for my patient, particularly for infants and children. Then to provide comfort, especially to my patient, then the first equipment needed is basin, pit filled with hot water and cold water, small towels. I have 6 small towels. Then rubber sheet for adults and for children, digital thermometer, then gloves. Assess of my patient, assess the condition of the patient. To data will serve as a basic and evaluating the patient response to the treatment. So, ma'am, I'm Aramipli Paktanak, your nurse for today. Ma'am, may I know if if okay lang po ba kayo? So, then is explain the method to the patient for the watcher. So by providing them some information about the procedure, it will be much easier for them to cooperate. So, ma'am, gagawin ko lang po ang application of therapeutic BAT sa inyo. Relax lang po kayo at ako na po ang bahala. Then, first is wash hands before clean the body of my patient. So, thoroughly before starting the procedure. So, I'm then clean my hands or wash my hands to prevent the spread of infection. So, next is close the door and partition sheet if at the ward. So, to provide privacy for my patient. So, the door is closed. So, adjust the patient bed certain height that is accessible for working to maintain the good body mechanics. So, then elevate the bed of my patient to maintain the body mechanics. So, place the bed protector or rubber sheet on my patient bed to provide bed illness from welting and soiling. So next, put on your working gloves. Then prevent transmission for contamination. Then, immerse the face towel in the water until saturated. Bring all equipment and set them on the area near the bed. So, my table is on the near of my patient. So, already done. Bring all my equipment and careful check all the material to make sure everything is there. So, I will make sure the equipment my needed is in here, my table. Then drape the patient properly and expose only the body part to be expanded to prevent patient from shivering. So uh, next is careful removing patient clothes and place the bath blanket of sponge. So the patient is properly positioned to prevent a patient from shivering. So I will remove the clothing of and place the bath blanket on the top. So next is bring out of the face towel before sponging the patient to avoid excessive wetness. So place cold moist washcloth in axilla and groin and remove it after to dry it. So to promote heat loss due to condition, make a knit with a sponge towel. So now I'm going to use one towel. Then for the head of my patient, and the next towel. Then next for the groin of my patient. Place the I make meat with a sponge towel for my patient. So pat patient face gently with a face towel, sponge patient, face down to the extremities of my patient. First is the face of my patient. Then the first right extremities of my patient, down to the hands. Then do the same on the left hands of my patient. Then bat extremely separately, but pat each area dry to after sponging and avoid rubbing with the towel. Then rubbing increase cells metabolism and produce heat. So next is place towel across the patient chest and fold down on the midline of the patient abdomen. I will do it for the abdomen of my patient. First is then do it in the left of my patient, to the abdomen. Then expose the further leg for folding the blanket diagonally and placing the towel under mate and sponge leg with a patting motion and with the right to the same on another leg. First, I do it in the right of the leg of my patient. We'll remove the towel under diagonally and spans put on the then do it same in the right leg of my patient. This is then for the turn the patient to the side and span his lower back to the buttocks for the 5 to 10 minutes. Nakakailan po ba? Ito na kayo. So, next is put on a clean, fresh laundry hospital gown for if you done put the wet face towel on the lower back and the buttocks. So if you done wet the sponge the lower back and the buttocks of your patient after 10 to 5 minutes, 5 to 10 minutes, put a clean and fresh the laundry hospital gown and cover him lightly. Then so before I'm doing the laundry hospital gown for my patient, I'm going to remove the face towel. Assume this is the hospital gown. Then remove the blanket and exchange it. Then, for the comfort of the patient, prevent patient from the shivering. So, and then document the date, time, and duration for the bath and the patient response to the procedure for legal purposes. So, ma'am, I'm done a therapeutic bath for you. So, sana nagustuhan nyo and naging relax po kayo sa aking ginagawa. Thank you po. And thank you so